Face reading, infertility. Women in their reproductive years who have no fertility problems and have normal sex lives and are not using contraceptives, but have not been able to conceive after having been sexually active for a year, or those who were previously impregnated but have not become pregnant after discontinuing the use of contraceptives for more than 1 year, are considered infertile. Infertility is clinically manifested as failure to get pregnant over a long period. The condition can also be accompanied by symptoms such as irregular menstruation, lower abdominal pain, lumbosacral pain, and abnormal leukorrhea. Modern medicine classifies the causes of infertility into 5 categories: ovulation dysfunctions, fallopian tube obstructions, underdeveloped uterus, chronic cervicitis or pelvic inflammatory disease, and congenital malformations that affect one's sex life. Face reading. If a woman's philtrum is flat or almost invisible, this indicates infertility. If the width of the philtrum is almost the same from top to bottom, and the edges of both sides of the groove are evidently thicker, this suggests congenital infertility. Therapeutic methods. Infertility is caused by both internal and external factors. So patients with infertility need internal regulation and external nourishment in order to improve. They should go to the hospital for an examination when they have concerns about pregnancy, and they would follow the doctor's advice for treatment. Dietary advice. Balance your nutritional intake and make sure that you have sufficient intake of essential proteins, vitamins, and microelements, which provide sufficient nutrition for ovulation. Exercise. Do more low intensity and relaxing exercise, such as yoga or walking. These exercises can not only strengthen your body and improve your immunity, but also relax your mood. Emotional adjustment. Adjust your state of mind and keep your mood balanced. In many cases, the eagerness for a child will only further interfere with endocrine function, making it difficult to conceive. Moxibustion. Applied to the Shenshu point as the main point, which has the effect of invigorating kidney qi, and combined with the Yaoyang 1 and Shangji points, which can improve the deficiency of qi and blood, or applied to the Taichung point as the main point, which has the effect of dispelling the phlegm and clearing blood stasis, and when combined with the Sanyin Jiao point, it can invigorate the spleen, soothe the liver, and tone the kidney. The main acupoints are generally treated every day, but the auxiliary acupoints can be treated in rotation for 15 minutes each, once daily. Moxibustions of these points can strengthen the functions of the liver, spleen, and kidneys to enhance the patient's ability to conceive. The illustration for the points. Thank you for your attention. Interviewing when emotions become causes of disease 3. The effect of each emotion on a relevant organ should not be interpreted too restrictively. There are passages from the Yellow Emperor's Classic that attribute to the effect of emotions to organs other than the ones just mentioned. For example, the spiritual axis in chapter 28 says, worry and pensiveness agitate the heart. The simple questions in chapter 39 says, sadness agitates the heart. The emotions, anger to liver, joy to the heart, worry to the lungs and spleen, pensiveness to the spleen, sadness to the lungs and heart, fear to the kidneys, and shock to the kidneys and heart. Furthermore, all emotions besides affecting the relevant organ directly, affect the heart indirectly because the heart houses the mind. It alone, being responsible for consciousness and cognition, can recognize and feel the effect of emotional tension. Fei Bo Shong, between 1800 to 1879, put it very clearly when he said, the seven emotions injure the five yin organs selectively, but they all affect the heart. Joy injures the heart. Anger injures the liver. The liver cannot recognize anger, but the heart can. Hence, it affects both liver and heart. Worry injures the lungs. The lungs cannot recognize it, but the heart can. Hence, it affects both lungs and heart. Pensiveness injures the spleen. The spleen cannot recognize it, but the heart can. Hence, it affects both spleen and heart. Yu Chang, in Principles of Medical Practice in 1658, says worry agitates the heart and has repercussions on the lungs. Pensiveness agitates the heart and has repercussions on the spleen. Anger agitates the heart and has repercussions on the liver. Fear agitates the heart and has repercussions on the kidneys. Therefore, all the five emotions, including joy, affect the heart. Chinese writing clearly bears out the idea that all emotions affect the heart, as the characters for all seven emotions are based on the heart radical. Thank you for your attention.
Let's discuss Han Yang Min large intestine meridian, shoulder joint. Here is the illustration of Han Yang Min large intestine meridian, LI15, on the anterior depression of the shoulder between the anterior end of the lateral border of the acromion and the greater tubercle of the humerus at the corner of the shoulder. LI15, shoulder joint, shoulder bone, shoulder transporting point, shoulder tip, and bone. Point of the Yang Kiao Mai. The large intestine divergent channel separates at LI15, enters the spine at the nape of the neck, do14, and passes down to join with the large intestine and lung. Second branch ascends from the shoulder along the throat, emerging at the supraclavicular fossa, stomach 12, to rejoin the primary meridian. The energetic geography here can be tricky to negotiate. It is a place of transition as the meridian ascends towards the head, and the head being the heavenly aspect of the body. The connections that LI15 makes here, the crossing with the Yang Chiao Mai with all its influence in the head and lateral aspect of the body, and branching from here to meet with Du14 and stomach 12, gives Jian Yu wide influence in this area of the body. The Yang Chiao Mai with its partner, Yin Chiao Mai, plays a part in regulating and balancing yin and yang and the rhythms of the body, which here reinforces the influence of the Pu with its regulation of the patterns and processes of the body. This may be why this point is beneficial for shock. Shock interrupts our inner processes and timing, and this point can help reestablish regularity. As a place of transition, this point reminds one of the tension metal exercises in maintaining the connection with the heavens and inspiration, the present moment, and justice even while in free fall. This point, with all its clear yang confluence, helps maintain the connection for the large intestine with chi of the heavens. Li15 brings refreshment, invigoration, and a sense of spaciousness to the brain through its position and connection with the Yang Chiao Mai. This can bring relief with the tendency of the large intestine to overprocess information and emotions, as well as headaches that can result from such overprocessing. The connection with Yang Chao Mai helps enliven the controller of drainage of the dregs when it has become dull or contaminated through overwork or deficiency, manifesting as a cynical, poisoned, and suspicious spirit, or a mental level with no longer distinguish the gems from dross in the material it processes or life. Good for mental and general exhaustion. Probably the most frequently used and most important local point for the problems of the upper arm and shoulder. It is also often used as one of the chain or group of points to free the shoulder. Li-15 benefits sinews, the yang min being rich in blood and qi, and so bringing warmth, nourishment, and strength. Moxa can be helpful here if appropriate. Promotes circulation of qi in the channels, connection with yang qiao mai. Expels wind through its connection with yang qiao mai, and thus can also be useful secondary point for skin rashes along with Li4 and Li11. Li15 can help to control excessive sweating with Li4 and Kidney7, or with Si9 for excessive underarm sweating, stops pain, soften hard masses. Given as a first aid point for apoplexy, concussion, electric shock, exhaustion, hemorrhage, head injury, shock. Indication: mental dullness and headaches, paralysis of the arm, shoulder, or hand, atrophy of the arm and upper body, arthritis, bursitis, trauma through shoulder, frozen shoulder, excessive sweating, thyroid, goiter. This point connects to the head, neck, brain, and spine along with 214 and stomach 12, and as such is effective for mental clarity and for invigorating the system. Often used for problems of the upper arm and shoulders. Consider moxa here for a frozen shoulder. For excessive sweating, particularly under the arm, beneficial when the system has been shocked or concussed. Thank you for your attention. Let's discuss heart patterns, heart fire hyperactivity. Concept: manifestation of heart fire flaming upward. Clinical manifestation: ill at ease and restlessness with a hot sensation in the chest, insomnia, red complexion, thirst, yellow urine and dry stool, red tongue with red crimson tip of the tongue or ulceration, and pain of the tongue, a powerful and rapid pulse, or mania and delirium, hematemesis, blood vomiting, epistaxis, nose bleeding, pyodermic diseases such as skin ulceration, pus, and swelling, example acne or dermal burning pain. Analysis: this pattern is usually caused by long-term depression of the 7 emotions causing chi stagnation, which turns into fire, or by invasion of exogenous fire pathogen, or by indulgence in fatty food or alcoholic drinks which can accumulate and turn into fire over a long time. Key symptoms: feeling ill at ease and restless with the hot sensation in the chest, insomnia, heart fixation, mania, and delirium. Red tongue with red crimson tip of the tongue or tongue ulcers, accompanied by symptoms of a full heat pattern. Caution: both heart fire hyperactivity and heart gene deficiency clinically manifest as a common symptoms of the heart and heat patterns, but the former is an excess pattern while the latter is a deficiency pattern. So here the analysis of heart fire activity for the internal hyperactivity or the heart fire in the chest, ill at ease with hot sensation in the chest, with fire heat disturbs the mind. There is insomnia, mania, and delirium. If exuberant internal heat, there is red complexion, thirst, yellow urine, and dry stool, a powerful and rapid pulse. If there is fire heat blazes upward along the channels, There's red crimson tip of the tongue ulcers, or even disintegration of the tongue. If there's excessive fire, causes frenetic movement of the blood. There's bleeding from stomach or nose. If there's heat blocking channels and collaterals and so obstructing the local circulation of chi and blood, this one, pyodermic diseases such as skin ulcers and swelling or dermal burning pain. Heart fire blazing, etiology, chronic anxiety, worry, anger. Underlying pathology, liver fire blazing. Signs and symptoms, there is mental restlessness, agitation, insomnia, mouth sores, red face, thirst, yellow urine, dry stools, spontaneous external bleeding, manic agitation, and delirious speech, sweating and red swollen and painful skin sores. Pulse rapid and overflowing, especially on heart position. Tongue red with redder teeth and yellow coating. Treatment principle, clear the heart and drain fire. Acupuncture treatment to clear heart fire, needle heart 8, pericardium 8, heart 9, REN 14, prick to bleed, pericardium 9, and heart 9. Select points based on symptomatology. For mouth sores, use kidney 2. For agitation and mental restlessness, use kidney 1 and pericardium 5. For insomnia, use heart 7, bladder 15, heart 5. For thirst, use Sanjiao 2, REN 23, kidney 6, spleen 6. For dry stool, use LI 4, LI 11, stomach 37, Sanjiao 6. For bleeding, use stomach 44, pericardium 4. Relevant advice, the patient should avoid all food and beverages that create heat. This will include things such as alcohol, lamb, chili, and other hot spices, deep fried foods, dark chocolate, garlic, and so on. The heart is already overstimulated in this pattern, and therefore it should not be further stimulated. This means that coffee, black and green tea, and anything that contains caffeine or other stimulants must be avoided. Thank you for your attention.
Pulse taking, short pulse. A short pulse is one that is palpable only at the quan position. At the Tsun and Shi positions, it is absent, or if present, barely and indistinctly palpated. Clinical significance, a short pulse indicates an illness of qi. A short but forceful pulse indicates that qi is strong, whereas a short but weak pulse indicates qi deficiency. The latter may be due to yang collapse, qi depletion, massive blood stools, accumulation of turbid phlegm, food retention, and blood stasis. The pulsation of the artery is due to propulsion by qi. If yang qi is weak and unable to propel blood flow, then blood flows slowly and the vessels become resistant. In such conditions, the pulse becomes short and weak. The pulse may be short also in phlegm accumulation, food retention, blood stasis, and qi impedance. These conditions cause impedance or blockage of the vessels, and a short pulse is the result. Narrowing of the arteries means that the inflow of qi and blood into the vessels is impeded so that the vessels cannot be filled to the full. Hence, the pulse is thread-like and weak. The blood also flows slowly, hence the short pulse. A pulse which fails to fill both the Tsun and Shi positions, fills the Shi position but not the Tsun, or fills the Tsun position but not the Shi, is a short pulse. The short pulse always feels dissatisfying. Its beats are strong, but it rises and falls abruptly. The short pulse is slightly different from the choppy pulse. A short pulse which is thin and weak with slow, difficult beats is called a choppy pulse. The short pulse occurs when the qi becomes deficient and unable to circulate smoothly. The lungs rule the qi. If the lung qi is deficient and damaged and unable to lead the circulation of blood, the pulse can become short or weak and deep. Kidney yang deficiency, which causes the qi to become obstructed and unable to nourish the 100 mai, which meet at the lungs, or phlegm stagnation or food accumulation which obstruct the trachea, will reflect in a pulse which is short and choppy. Clinically, the short pulse most commonly occurs with symptoms of qi and blood deficiency. Damage caused by alcohol poisoning or internal excesses of damp heat causes the pulse to become short, slippery, and rapid. Blood deficiency, which is unable to nourish the pulse, will cause it to become short and floating. Fullness of the chest and abdomen will result in a pulse which is short or strong and deep. Deficiency of yang qi in the upper part of the body causing headaches gives a short pulse at the tsun position. Deficiency of yang qi in the lower heater or pain in the abdomen will give a short pulse at the shi position. Thank you for your attention. Diagnosis according to Zhang-Fu organ patterns. We will discuss extreme heat generating liver wind. Liver wind can arise as a consequence of 4 different imbalances. Extreme heat in the whole body, for example, when a fever creates blood heat, which then creates heat in the liver. Chronic ascendant liver yang, which will often be the cause of liver wind in elderly patients. Liver blood deficiency, where liver blood, which is an aspect of liver yin, is not able to anchor liver wind, which is an aspect of liver yang. Liver fire, where the fire burns so intensely that it generates wind. Wind in the body is similar to climatic wind in several ways, and it can be just as destructive. It can be as mild as a light breeze and cause only mild symptoms, such as tics or a slight dizziness, or it can be as wild as a hurricane and cause paralysis, spasms, and a cerebrovascular accident, particularly when wind is created by heat. It can be very destructive and sometimes even fatal. One of the dangerous aspects of wind is that it can stir up phlegm, swirl the phlegm up to the head, and block the orifices. This will cause the person to lose consciousness and the ability to talk and make the tongue stiff. Phlegm can also block the channel, so the person becomes paralyzed. Some of the disorders in Western medicine caused by internally generated wind are meningitis, tetanus, febrile convulsions, epilepsy, and a stroke. Wind can create a gentle movement like a flag fluttering gently back and forth on a summer day, but it can also make the same flag stand rigid and stiff in the air, moving to neither one side nor the other, as in an autumn storm. In both cases, it is characteristic that the movements are involuntary, and this is also the case in the body with all involuntary movement of the muscles, twitches, cramps, and spasms being due to wind. Extreme heat generating liver wind. If there is extreme heat in the body, such as when there is an invasion of exogenous pathogenic qi, for example, the pathogenic qi can generate so much heat that it affects the liver, with the heat in the liver generating wind. This is comparable to a forest fire. When there is a forest fire, the hot air will rise upwards. The vacuum this creates will draw in the air in from the surrounding area, and this creates a strong wind that rushes upwards. The symptoms of this imbalance will be acute, and they will often be extreme. In Western medicine, diseases such as febrile seizures, tetanus, and meningitis fall within this category. Exposure to exogenous pathogenic factor is the main cause of this pattern. If there is already heat present in the body or the person is yin deficient, this pattern will arise quickly. This is typical in babies as they are relatively young with a warm constitution, but their yin is weak. They therefore have a greater tendency to develop febrile seizures than adults when there are invasions of exogenous pathogenic qi. This means that they are very vulnerable when there are epidemic diseases. Symptoms and signs: high fever, extreme thirst, red face, the skin feels quite hot when palpated, dry, red lips, seizures, muscle spasms, extreme stiffness in the neck and back. The back can be stretched and bent like a bow. Involuntary clenching of the hands and toes, shaking or involuntary movements of the limbs, such as in epilepsy. The jaw may be locked. In extreme cases, the eyes may be closed, staring or upwardly staring. extremely red tongue that is stiff and motionless, possibly veering to one side. There will be a dry and yellowish or black coating, rapid and wiry pulse. Key symptoms are tremor, spasms, high fever, and a rapid, wiry pulse. Treatment principle, calm liver wind and drain heat. Acupuncture points, we choose from liver 2, liver 3, Sichuan, Jing, well points, do 8, 14, 16, 20, GB20, and LI11. Dental technique is draining, Sichuan and Jingwell points should be bled. Liver 2, liver 3, and do 8 calm the liver and extinguish liver wind. Sichuan and Jingwell points drain blood heat and extinguish internally generated wind. Do 14 drains the fire and extinguishes internally generated wind. Do 16, GB20, and Do 20 extinguish internally generated wind, especially when the symptoms affect the head. LI11 drains heat. This is an acute condition that is caused by an invasion of exogenous pathogenic Qi that has penetrated to the blood level. Dietary and lifestyle advice are therefore of less relevance. Extreme heat-generating liver wind can be caused by invasion of exogenous pathogenic factor, and it can result in phlegm wind. To summarize, the etiology of extreme heat-generating wind is invasion of exterior heat or wind heat penetrating to the blood level, generating internal wind. Underlying accompanying pathology, this pattern is only encountered with acute febrile diseases. Possible presenting conditions are measles, encephalitis, meningitis. Signs and symptoms: high fever with thirst, red face and eyes, convulsions, rigidity of the neck and back, upward staring eyes, clenched jaw, tremor of the limbs, in severe cases. Pulse, widely rapid, tongue, deep red, stiff, dry yellow coating. Treatment principle, calm the liver and extinguish wind, clear heat. Acupuncture treatment, GB20 extinguishes interior wind, LI11 subdues hyperactive liver qi, heart 8 quiets heart, regulates spirit, liver 2 clears liver heat, extra point Sichuan clears heat, extinguishes wind, 220 extinguishes interior wind. Liver 3 dispenses liver, subdues wind, pericardium 8 extinguishes wind, cools blood, 2-8 extinguishes wind, relieves spasm, 214 extinguishes wind, clears heat, SI3 extinguishes wind from governing vessel, 216 extinguishes interior wind. We needle with drainage and prick 12 well points to bleed. Thank you so much for listening. Tongue form inspection. Enlarged tongue, atrophied tongue. The main abnormal forms of the tongue are enlarged, atrophied, hairy, fissured, and indented. In mild cases, the enlarged tongue fills the mouth and has some indentation from the teeth. This is said to be a plump tongue. In severe cases, the tongue is so large the patient is unable to retract the tongue and close the mouth. This is said to be a swollen tongue. In general, a plump tongue reflects water retention or blockage by phlegm and dampness. This usually results from deficiency of qi, insufficiency of yang, or spleen deficiency, so that the fluid's metabolism is disturbed or the phlegm and rheum overflow upward. A swollen tongue, on the other hand, reflects qi stagnation in the upper body and blazing heat and fire in the heart. Clinically, sometimes it is difficult to distinguish the significance between the plump and the swollen tongue, and the physician must rely on the color of the tongue to diagnose cold, heat deficiency, or strength. For example, a pale, tender, and plump tongue with white coating suggests retention of fluids due to deficiency of spleen and kidney yang qi. An enlarged tongue that is red and is covered by yellow and greasy coating suggests dampness heat causing phlegm to flow upward. A crimson and yet swollen tongue suggests blazing heat in the heart. Moreover, a purplish blue and swollen tongue suggests poisoning by alcohol and blood stasis due to poisoning. Atrophied tongue. Atrophy of the tongue is due to loss of nourishment because of deficiency of both heart and spleen qi. As a result, qi, blood, and yin fluids are deficient, and fire blazes in deficiency. A pale and atrophied tongue suggests deficiency of both qi and blood. An atrophied and red or crimson tongue suggests intense heat enduring yin or blazing fire due to yin deficiency. According to recent advances in tongue research, other conditions can also lead to atrophy of the tongue, such as deficiency of certain vitamins, blood deficiency, digestive dysfunction of the stomach and the intestines, malnutrition due to severe infections, and muscular dystrophy involving the tongue. Thank you for your attention. Let's talk about epigastric pain due to stomach yin deficiency. Clinical manifestations: dull epigastric pain, dry mouth, desire to sip liquids, dry throat, dry stools, slight nausea, feeling of heat, night sweating. Tongue, normal color, dry, no coating, scattered cracks, or a central, wide, stomach-type crack. Pulse floating empty in the right middle position. If, in addition to stomach deficiency, there is some empty heat, there may be the following manifestations: malar flush, 5-pound heat, red tongue, rapid pulse. Treatment principle: nourish yin, benefit the stomach, stop pain. This is the diagram of a tongue with a stomach crack. Points for stomach deficiency: REN 12, stomach 36, spleen 6, reinforcing method. REN 12, stomach 36, and spleen 6 nourish stomach yin. The patient should avoid eating drying foods, that is, baked or broiled foods, including bread. It is beneficial to eat warm and moist foods, such as soups and porridge. Case history: we have a 37-year-old man who had been suffering from epigastric pain for many years. The pain was rather dull but persistent and was accompanied by slight nausea. The pain was better for pressure. His mouth felt always dry, but he liked to sip liquids. His lips and stools were also often dry. His tongue was slightly red without enough coating and with very clear stomach and spleen cracks. The stomach crack runs vertically in the midline, while the spleen cracks are transversal on the edges. His pulse was floating empty on the right middle position. This is a very clear example of stomach and spleen yin deficiency. The latter often accompanies the former, and its symptoms are dry lips and stools, apart from the transversal cracks on the edges of the tongue. Besides yin deficiency, there is also some stomach empty heat as the tongue is red. So this is the tongue of the patient, stomach and spleen yin deficiency. The principle followed was to nourish stomach and spleen yin and to clear empty heat. This patient was treated with acupuncture and herbs. The points were selected from the following, all with reinforcing method except for stomach 44. Stomach 36, REN 12, and spleen 6 to nourish stomach yin. REN 11 and stomach 44 to clear stomach empty heat. Thank you so much for listening.